Hi, I'm Dr. Amy Deerking from St. Cloud Ear, Nose and Throat. If you're watching this video, your child is probably planning to have a set of ear tubes placed. They're sometimes called tympanostomy tubes or ear tubes or even pressure equalization tubes. What that's for is lots of ear infections, and that's why we use them. And so what we're trying to do is give you a little information today on knowing what to expect after this surgery for your child. This is a very quick procedure. It's very common. It takes anywhere from 5 to 10 minutes, but they are going to be asleep. It is a general anesthesia. Typically, we don't have to use a breathing tube for most kids when they have ear tubes placed. Most kids will be able to just use a mask over the nose and mouth to give them the gases that keep them sleeping, and then put the tubes in and wake them up, and they're able to recover pretty quickly. Occasionally, if your child's having another procedure at the same time as the ear tubes, then we may need to use a breathing tube and even have an IV placed. But most of the time, if it's just a set of ear tubes, it's a very quick procedure, and the recovery is actually pretty tolerable. What you will notice after your child has ear tubes is that they may have some ear drainage. Not all children will, but some children will have some drainage that comes from the ears, especially if at the time the tubes were placed there was an ear infection present. Then you may see colored drainage. It could be white, yellow, or green. It may even be blood tinged. Sometimes it's clear, sometimes it's a little yellow, could be sticky, or it could be pretty thin. Drainage, though, is typical. It's not abnormal. It's nothing to be alarmed about. Sometimes after the surgery, you'll be given some ear drops, and that's especially the case if there was sign of any infection when the tubes were placed. The ear drops would be used to help clear out that infection and to treat the infection and help the ear to heal. If you've been given ear drops by your surgeon, what you'll need to do with your child is have them laying on their side, and then I want you to turn their head to the side, and I want you to grab their ear and pull it upwards and backwards. And their head will be sideways like this, but you'll pull the ear up and back, and then you put the drops into the ear canal. And it's typically 4 drops at a time. And then what you'll need to do is wiggle the ear. Sometimes you pull backwards or you push on this part of the ear right in the front, and you wiggle and push until you see the eardrops drain all the way down into the ear canal. If you're still seeing drops at the outside of the canal, you need to do some more wiggling and some more pushing until they completely drain into the ear. Then once they've drained down into the ear canal, I want you to keep your child on their side for about a minute if you can. If it's even a little longer is better, because that allows the drops to really soak in and help to treat the infection. Then you'd have them turn over and do the same thing on the other side if both ears were affected, or if you were told to treat both ears. Sometimes drops are only needed on one side. That then you would use for as number of days as your physician has told you to use. It's typically done twice a day. The other thing to know about is that there's generally not too much pain after the ear tubes are placed. The placement of the tubes can be uncomfortable for the child, and that's why they're asleep, but after they're in, it's usually not that uncomfortable. So you may not need to do any sort of treatment with any pain medication. If your child does seem to be uncomfortable, Tylenol or ibuprofen is just fine. You can use either one of those if they're uncomfortable. The next thing to be aware of after surgery is when can they eat? What can they eat? So generally, if it's an infant, we would let them start feeding with a bottle or breastfeeding immediately right after they wake up if they're hungry. And there's really no change in their diet if they're a young child. For the older children, we would start with clear liquids first, so things like juice, water, maybe a popsicle or some Jell-O. And if those things stay down and there's no nausea, then you can start using other types of foods. And I usually stay with a real light meal the first day. Don't take anything real heavy. We don't want an upset stomach. We don't want them getting nauseated or vomiting. But after that first day, if they're feeling back to normal, you can start eating regular foods by the very next day. Other things you may notice the day of the surgery is there can be some fatigue or extra long nap or an extra nap even from the effect of the anesthesia. That's pretty typical and normal, but that should pretty quickly get back to their normal routine. There usually aren't fevers after this surgery, but it's possible. If you noticed a fever, you can use Tylenol or ibuprofen, and if the fever comes down, then I wouldn't be too concerned about it. However, if your child's fever does not get better with treatment with ibuprofen or Tylenol, you should call your physician. We have a phone number available to call at any time. If it's during business hours, one of our nurses will help try to answer your question, and if they need help, they'll find your surgeon and talk to them about it. And if it's after hours, we have an on-call phone number that would get to the person who's on call, and they'll be able to get it back to you and help answer any questions that you might have. This is a surgery we do frequently. We will take good care of your child, and I hope that this will help with any ear infection problems and that you'll have a healthier, happier kid after we do this surgery.